Welcome back in. Well, you've probably dealt with it at some point, that pesky heartburn, but when is it something to be concerned about? This afternoon we have Mercy Health surgeon Dr. Gregory Johnston with us so we can learn a little bit more about GERD. What is GERD?
So reflux, or GERD, commonly known as heartburn usually, is an abnormal acidic regurgitation of acid up into the lower part of your esophagus. That's obviously causes those fun symptoms such as burping, regurgitation, things like that.
Yeah, and it is uncomfortable. It does not feel good, does it?
No, absolutely not. It causes a lot of people discomfort. About 20% of the United States population will actually have reflux on a daily basis.
Wow.
So yeah, it's pretty common. But again, it's usually a benign thing. Usually doesn't follow an indolent course. However, can cause a lot of problems for people. So
what are some treatment options then? You know, you start to feel it a little bit. We got to do something about this.
So I think the first thing I think people commonly forget is that lifestyle behaviors can usually change this, all right? Stopping smoking, stopping drinking, everybody loves their excess caffeine. However, getting rid of some of that on a daily basis can really help how that lower sphincter works.
Okay.
And improve your symptoms.
Okay, so what are some, though, red flags, though? Like, hey, this is more than just a little heartburn.
Absolutely. So we typically categorize GERD into two things, typical symptoms and atypical symptoms. So again, normally the one is the regurgitation, the acidic contents, that heartburn feeling. But then people can have other things such as trouble swallowing, all right? If they are red flags, particularly trouble swallowing, painful swallowing, and then if the vomiting blood or passing blood.
Oh yeah, okay, that's a big red flag. Right. Yeah, not good.
Correct.
So you're a surgeon, obviously. So what kind of surgery can you do on something like this?
Sure, we typically do. So there's a lot of different ways now, but the gold standard historically is what we call the fundoplication. That's where we basically rebuild the lower esophageal sphincter or recreate a high pressure zone there. So again, keeps that acid content down and keeps it from coming up into your chest.
Okay, so at what point, somebody can come in, should they start with maybe they're just, primary care physician?
Yeah, absolutely. So, when to come see a physician, really you want to come see someone when you're having recurrent symptoms, right? Something's happening on a daily basis or something changes, right? Maybe the symptoms became dramatically worse. Maybe you just had heartburn and then it moved on to, okay, now I can't swallow and things are getting stuck, things like that.
Yeah, so, and then you can get referred and maybe surgery is a good option for you.
Surgery, absolutely. Surgery is still considered basically the gold standard, but we really like to start with, again, lifestyle modifications, and if we can treat people with medications, that'll really, build on their life instead of running off to surgery.
Is there a certain, group of people or, age maybe even who is particularly at risk for this?
Really, here in Northwest Ohio, people who are overweight. So actually having that weight creates a bigger pressure in your abdomen, and again, creates a. So one of the big things you can actually do is actually lose some weight, and that will help your symptoms a lot.
But age-wise, it doesn't really matter, huh?
Age-wise, as you progress, right, symptoms usually get worse. We ignore things earlier in life, and as we move on to later in life, things can get worse. You want to worry about progression of symptoms though, because it can lead to, what we're really about is esophageal cancer.
Oh, okay. So this could,
Right.
Don't ignore this.
Don't ignore it in the long term. And again, come in for those red flag symptoms, pain, difficulty swallowing.
When you are working with patients and you're able to provide a little bit of relief for them, what is that like for the patient to get to that point?
Oh, it's a big change, right? A lot of people want to get off medications, right? I think everything, any kind of medication they can get off, they're happy. But when you bring somebody back and you fix their reflux, they don't cough anymore, they don't bend over and regurgitate, they can lay flat at night. Those are great things for people.
That's huge. Being able to sleep,
life.
sleep comfortably,
Right.
A big one. So if you are experiencing some of these symptoms, maybe they're getting a little bit worse, now is the time to get in touch with your doctor and get it taken care of. And as you said, maybe start with some lifestyle changes, get you started,
Absolutely.
and then see what else might be.
Simple lifestyle changes can make a significant barrier. Other things, you can do, don't eat meals 3 hours before bedtime, right? Sleep with your head slightly up. Those are all things that are going to help you with those daily symptoms.
Very good, doctor. Thank you so much for being here today. We appreciate it.